We need a constant supply of oxygen to survive. If our brain cells don't get oxygen, they start to die within 3 to 4 minutes. The priorities of treatment are making sure oxygen gets into the blood and that the blood carries it to the brain. The primary survey is a fast and systematic way to find and treat life-threatening conditions in priority order. If a life-threatening condition is found, it should be treated immediately before moving on to the next step. Use DRABC, Dr. ABC, to remember the primary survey sequence. Perform a primary survey first on every casualty, and until it's complete, do not be distracted by more superficial, non-life-threatening conditions. D. Danger. Make sure you, the casualty, and any bystanders are safe. Don't put your own life at risk. One casualty is enough. R. Response. Quickly check to see if the casualty is conscious. Gently shake or tap the shoulders and ask loudly, "Are you all right?" Unconscious casualties take priority and need urgent treatment. If an unconscious casualty is on their back, the airway can be at risk. A. Airway. Identify and treat any life-threatening airway problems. If the casualty is unconscious, tilt the head back to open the airway. When the airway is clear, opened, move on to breathing. Life-threatening conditions. Airway swelling, narrowing, or blockage caused by the tongue, vomit, choking, burns, strangulation, hanging, anaphylaxis. B. Breathing. Identify and treat any life-threatening breathing problems. If the casualty is unconscious and not breathing normally, perform CPR. When life-threatening breathing problems have been ruled out or treated, move on to circulation. Life-threatening conditions. Asthma, crushing of the chest injury, collapsed lung, poisoning, anaphylaxis, cardiac arrest. C. Circulation. Identify and treat any life-threatening circulation problems. When life-threatening circulation problems have been ruled out or treated, the primary survey is complete. You can now look for other, less urgent problems, such as broken bones. Life-threatening conditions: heart attack, heart failure, severe bleeding, poisoning, anaphylaxis, cardiac arrest. Multiple casualties. Use the DRABC primary survey to decide who needs treatment first. A rough rule of thumb is that the casualty who is the quietest needs treatment first, whereas the one making the most noise, trying to get your attention, is the least serious. Recognizing life-threatening conditions. During the primary survey, it is important to recognize and treat any life-threatening conditions. As a rule, a condition is life-threatening if it interferes with oxygen getting through to the vital organs of the body. If the body has a lack of oxygen, we call this hypoxia. The body's emergency response. If the body detects low oxygen levels, the emergency hormone adrenaline is released, which diverts blood away from the skin and stomach, diverts blood towards the heart, lungs, and brain, increases the heart rate, increases the strength of the heartbeat and blood pressure, opens the air passages in the lungs. Adrenaline creates dramatic signs and symptoms that the first aider must be able to recognize. Recognition of hypoxia. Pale, clammy skin. For darker skin, look at the color of the skin inside the lips. Blue tinges to the skin and lips. Cyanosis. Increase in pulse rate. Nausea or vomiting. Increased breathing rate if the brain detects low oxygen. Lowered breathing rate indicates a brain problem. Distressed breathing or gasping. Confusion or dizziness. These signs and symptoms are caused by adrenaline.